name is Tara, and today I'm going to be doing an NG insertion. I would check my doctor's orders, gather my supplies, walk in my patient's room, provide for privacy. I'm going to do hand hygiene right now. I'm going to check my patient identifiers as well, make sure I have the right patient. I'm going to let them know today we are going to do an NG insertion. And I'm going to first do an assessment on them. I'm going to check their ball sounds first in all 4 quadrants. And you want to check these for 5 minutes each. And then I want to do a palpitation on the stomach. Just make sure that there's no distension, any pain at all, discomfort that they may be experiencing. I want to check my patient's nostrils as well. Before I'm going to do that, they will be in a high Fowler's position for this procedure. We do have to prop them up with pillows today because this bed is not working right now. I want to assess their nostrils, make sure there's no polyps, any deviated septum. This patient's good to go. I'm going to go with the left nostril today for this procedure. I want to provide for hand hygiene one more time. And I'm going to don clean gloves. They do have an emesis basin. They have a napkin as well, just in case the patient does have a large emesis. There is a basin there for them. Chuck's pad is down as well. This would be the NG tubing. And this would be the anti-reflux valve, so I'm going to put that in right now. Blue against blue. I want to measure with the tubing, and how you do this is you start with the tip of the nose to the tip of the ear to the xiphoid process. Place a piece of tape right around that area. This is an estimate as to how far the tube is going to be inserted. This is a mannequin, so today this is not going to be going down that far. Coil the end of the tubing. Make sure it's kind of bent for easier insertion. I'm going to lubricate at least 3 to 4 inches. I'm going to start the procedure. So I'm going to start inserting the tubing. If my patient feels any discomfort whatsoever, I let them know to raise their hand. Once they start gagging, I'm going to have an assistant here. They're going to help me with letting this patient drink water. There's a straw in this cup. I'm going to have the patient start drinking. As they swallow, 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 I'm going to advance the tubing more. Okay. We've reached the desired length. I'm going to just secure this, not all the way though, because I need a check placement. Secure it as much as I can. To check your placement of the tubing, you need to draw up 10 cc's of air, and you want to inject it into the tubing. And as you're injecting the 10 cc's of air, listen to the left of the xiphoid process for a swoosh. Now if I don't hear that swoosh, I'm going to just draw back on the syringe about 3 to 5 cc's of stomach content. I'm going to aspirate that into the syringe, and I'm going to test it on a pH strip. I'm going to test the pH strip for a level of 0 to 4. That means it's in the right area of the stomach, which it is. So I'm going to hook this up to the suctioning, not turning it on yet. If the patient has any gagging problems, I do need to check the back of the throat for any coiling at all of the tubing. If it were coiled, I would have to possibly just pull it back a little bit and see if that helps at all. I'm going to finish securing this tape. Just kind of wrap it right around the tubing here. Okay, and then this piece of tape is already, actually you would take another piece of tape because this is where I marked as far as how long I'm going to, or the distance with the tubing. Push another piece of tape on that tubing and secure it with a safety pin onto the gown. And then I'm going to inject 10 cc's of air into the blue tubing. I'm just to remove the anti-reflux valve out of there first. By injecting the 10 cc's of air, this is actually going to remove it off the stomach wall, the tubing. And that's done. And then I'm going to turn the suctioning on. I would raise the railing, give my patient their call light. I would remove all my supplies. I would provide for hand hygiene, and I would document how the patient tolerated the insertion. Next, I'm going to do an irrigation of the tubing. Patient, it seems like there's a little bit of blockage in the suctioning. I'm going to see if I can help with getting that out. So what I would do is come into the room, provide for privacy, hand hygiene, and I would don clean gloves again, which I've already done that. I'm going to turn my suctioning off, just let my patient know I'm going to irrigate the tubing to try to get that dislodgement out of, or try to dislodge whatever is in the tubing out of there. I'm going to kind of just disconnect it right out of the tubing here. First, I'm going to just do an assessment again for placement. I'm going to drop 10 cc's of air, and I want to listen to that swish sound left of the xiphoid process. I'm going to place my stethoscope, listen for the swish, okay, and then I'm going to help with that dislodgement. So what I'm going to do is draw up 20 or 30 cc's of water. You can just use normal water. Let's try that again. Okay. So there's 30 cc's of water, and when you inject it in, you're going to want to kind of start doing just a pumping action. That should dislodge whatever is in the tubing out of there, which it did. And then I'm going to hook this back up to the suctioning. I'm not going to turn it on yet, because I want to also inject 10 cc's of air into the blue tubing to get the tubing off the stomach wall again. Okay. And just make sure to turn the suctioning back on. Raise the railing, give the call light to the patient, and clean up, provide for hand hygiene. Next, the doctor has ordered the removal of the NG tube, so I would come in the patient's room, identifiers, provide for privacy, do my hand hygiene, let the patient know I'm going to remove this tubing. I'm going to check for an assessment first. I'm going to check the 4 quadrants of the abdominal area, 5 minutes each. And then I want to turn the suctioning, the suctioning would have already been turned off before I had done the assessment of the quadrants. I want to remove the tubing from the suctioning. Just place it right up there. Next, I'm going to check for placement. So 10 cc's again of air. Listen for the swoosh on the left side of the xiphoid process. If no swoosh, you do need to aspirate 3 to 5 cc's of the stomach content. Test it on the pH strip, 0 to 4. That would be correct placement. Next, I want to draw up 20 cc's of water and 20 of air. And I'm just going to inject it right into the tubing here. And this is going to irrigate the tubing, just to clear it out. Okay. And the tubing's ready to be removed, so I would loosen the tape. I would unpin it from the gown, and hand over hand, as the patient's taking a deep breath, I want to remove the tubing. I'm going to clean up. I'm going to provide for hand hygiene, raise the railing, give the patient the call light, let them know, or I'm going to also document their intake and output, and see if they need anything else. I would go ahead and document everything, toleration and of the procedure.